2 months ago, Australia was looking forward with hope to a relatively smooth run out of this pandemic, to enough vaccination coverage later in the year to start opening up. Today, case numbers from this Sydney outbreak will burst through 6,000. Hundreds are in hospital, 32 people are dead. The news was promising, though, from most of the regions yesterday, but there was also that bump in cases in Melbourne yesterday, and we've just had word through of another 20 figure there in Melbourne today. So going from north to south, no cases in Cairns yesterday, and a decision due today on whether the snap 3-day lockdown will end there or not. In Brisbane, 4 more cases yesterday, but continuing optimism that that cluster is under control. If you head south down into regional New South Wales, Byron, Tamworth and Armidale there, no more cases yesterday, although continuing concern about the potential for more cases in that northern rivers area around Byron Bay, considering how much time one of those cases was positive in the community there. And a case has popped up in Dubbo in the central west of New South Wales, which no doubt we'll hear more about today. In the Hunter region, just to the north of Sydney, including Newcastle, under lockdown, 13 more cases yesterday and 68 exposure sites there now. In Sydney, Greater Sydney, the biggest day of cases yesterday, and I know this lockdown has dragged on in Greater Sydney, but it still feels like this point where we're reaching 6,000 cases today has come around so quickly. Melbourne is in a week-long lockdown, which is due to finish tomorrow night, but those 20 extra cases popped up yesterday, and word through today, just in the last few minutes, of another 20 cases detected. So there's uncertainty about what's going to happen there. But the one positive aspect to that today is the proportion of those 20 who'd been isolating while infectious, and we'll hear more about that later. Okay, so let's take a look at the states in detail. We'll go to New South Wales first, where there are by far the most cases, and there's increasing concern about what's going on in the Newcastle region as well. Before we go to our reporter, we'll take a quick look at the graph on the Sydney numbers, or the New South Wales numbers. So yeah, the biggest daily case numbers yesterday, 356. The yellow portion of these bars is the number of cases confirmed to have been infectious in the community, and the red portion of these bars is cases where it had not been determined by the end of the day if they'd been infectious in the community or not. So the potential for even further spread continues to be significant. Reporter Lara Himes joins us now from Sydney. Lara, what can you tell us?
Good morning, Joe. Well, there was a huge bump in the numbers of COVID cases recorded yesterday, a record of 356. There were also 4 deaths linked to that. Among them, a man in his 80s who was linked to the Liverpool hospital cluster. Now, the exposure site list continues to grow, not just in Sydney, but also in regional areas. In that list, we've had some cases recorded around the mid-north coast, the Byron region, and also Dubbo recording a case that was linked to a school. We understand that that school has been closed for cleaning, and that high-level talks are underway to determine whether or not Dubbo is likely to go into a lockdown. We've also been told that 2 workers that have been connected to the Leichhardt bus depot have tested positive to COVID, and as a result there have been several bus routes that operate through the inner west of Sydney which have now been cancelled. The remaining routes which operate through that depot are going to be experiencing significant delays. We also know too that construction workers which are from those local government areas of concern, there are about 8 or so now, are able to return to work sites if they've had their first dose. However, those work sites have to work at reduced capacity.
Okay, and what happened with this state parliamentary inquiry yesterday?
Well, this inquiry was set up to determine what the decision-making process was behind the New South Wales government implementation of the lockdown. Essentially, we heard yesterday that in hindsight, things may have been done differently, and that authorities had actually underestimated a seeding event, a birthday party at West Hoxton in Sydney's western suburbs.
With the benefit of hindsight, I think it's very clear to see that there was a greater risk of the seeding event in southwestern Sydney that was appreciated at the time that emerged, and that led for the lockdown.
There was also some conjecture about vaccination rates and what would be required by Sydney Public and also New South Wales, or what would be needed in a bid to ease some of those restrictions. The Premier had earlier put forward that 50% vaccination rates would be required to ease off some of those restrictions so we could have greater freedom. However, Chief Medical Officer Kerry Chand said that the vaccination targets would need to sit around 70% before there'd be any great easing of restrictions in Sydney.
Okay, Lara Holmes there in Sydney. Let's head south to Victoria now, and word through just in the last 10 minutes or so, another 20 local cases detected. The Health Department says 6 have been in the community while infectious. So before we go to our reporter, we'll take a quick look at the numbers in Victoria. And this goes back to last month, where Victoria was able to get the numbers back down to 0 with that previous outbreak. But then there have been these fresh cases in the west and the north over the last several days, jumped as high as 29 5 days ago. And the numbers through over the last couple of days, including today, that number's just come through. So 20 cases yesterday and today. Reporter Talia Alatia joins us now from Melbourne. Talia, g'day. So yeah, those numbers just through, and while some people might be, like the initial reaction might be, oh geez, another day of 20, there are some reasonably positive aspects to these in terms of the number who've been in isolation.
Absolutely. It's the fact that 14 of the 20 have been in quarantine while infectious that does give us a little bit of hope. Those 5 mysterious cases, not so much. But the government has said a key measure of getting out of this lockdown is making sure that people are not infectious in the community. So the trajectory of that rate has been really good. Like on Monday, of the 11 cases, 1 was in quarantine. Yesterday, there were 5 of the 20 cases, 5 in quarantine, and today, of course, 14. So those percentages go 9%, 25% and 70%. So that is definitely a good sign. The concern, however, is that there still is like 20 cases day after day. But it means that, you know, if we know that people are being in quarantine, it will help us stop the spread of the virus. It will help us get in front of the virus, and therefore it will mean that Victoria will be able to come out of lockdown, although I don't think those numbers have made anyone think that that's going to happen tomorrow.
Yeah. And Talia, just take us through what's happened over the last several days with this outbreak in Victoria, and what are the suburbs or areas of concern?
So, Joe, the real area of concern is Caroline Springs, and in particular the CS shopping square where I was at yesterday. So we now know that there's 118 active cases, and doing the maths from yesterday and today's numbers, 96 active cases with this outbreak. 25 cases were just in the Caroline Springs area yesterday, and I feel that it would be safe to assume that there will be more cases connected to Caroline Springs in today's number. We're yet to get the detail of those. So authorities really looking to that area, considering that there are like 76 exposure sites for the Caroline Springs area. They're telling people, particularly those who have been at that shopping precinct, to go and get tested. Staff who have worked there from August 2nd to August 5th, they're now considered tier 1 and are being told to get tested and to isolate. What's really concerning, and I think that this is what's worrying officials, is that they're both reporting positive cases, but the testing numbers were really low on Monday. It was only at like 1%. So testing operations really have been expanded in Caroline Springs to catch as many people as possible.
And Talia, for people outside Melbourne, because I'm sure the people of Melbourne are very familiar with how many days you've been under lockdown for this most recent period, just take us to when did this most recent lockdown period end, and when is an announcement expected? Sorry, when did it start, and when is it expected it's going? Whether they're going to make an announcement whether it's going to end or not?
So for those people outside of Victoria, they might remember last Wednesday morning we had a donut day. I think every Victorian was yelling out donut, so people may have known it was there. But by the afternoon there was that one case from Autaqua. It was the teacher who lives in the Hobson Bay area, not linked to the other outbreak. But the concern is that, you know, her partner who was in Newport, who actually works in, had the Newport family members and then the Newport football club and that West Footscray. So all all of these cases are coming back and being linked to those kind of events. So what happened is we had the Autaqua teacher, of course, because she was at such a big school. That's why we went into lockdown last Friday. My days have been very mixed up, but it was supposed to be a week-long lockdown that was slated to end tomorrow Thursday night. But this is our lockdown 6, and like lockdown 5, it was supposed to be a snap lockdown that lasted a week, but was extended. So I think that like Victorians and especially Melburnians, considering regional Victoria, are out of lockdown. I think we are kind of going, these are the patterns we've noticed in past lockdowns. This is what we're seeing, and which is why we are expecting the lockdown to be extended, but there hasn't been any confirmation of that yet.
Yeah, okay, Talia Alatir reporting there from Melbourne. Let's head north now to Queensland. The Cairns region is entering the third of what could be the final day of lockdown after no new cases yesterday. It comes as Queensland Health opens a new mass COVID vaccination hub at the Brisbane Convention Centre. Premier Anastasia Palaszczuk is due to hold a media conference, a coronavirus update, in about 50 minutes' time, and we'll bring you that live here on the ABC News channel. Before we go to our reporter in Queensland, a quick look at what's happened with the numbers in Queensland over the last several days. So just 3 or 4 cases yesterday, all linked to the Indooroopilly outbreak in Brisbane's west. All had been in isolation, so they're really confident that they remain on top of what's happening there in southeast Queensland, with the lockdown having ended now a couple of days ago there. And thankfully no fresh cases at all up in far north Queensland, which is, I'm sure, come as a bit of a surprise to people, because there was a taxi driver in the community infectious for a period of 8 days, I think it was, but so far no more transmission from that. Reporter Mark Rigby joins us now from Cairns. Mark, g'day. So what's the turnout been for testing like there in far north Queensland?
Yeah, good morning, Joe. Well, the good news is testing has been, or people have been turning out for testing en masse. To the 24 hours to midday yesterday, Queensland Health tells us more than 5,000 people were tested in the region. More than 3,000 of those, though, were tested at private pathology or testing clinics. And there is a slight downside to that, in that the results from those tests are a little bit delayed. Those tests need to be sent from Cairns down to Brisbane to be analysed, and as such, that accounts for that delay. This latest lockdown does all spark, as you say, from a positive test result in a Cairns taxi driver who authorities believe was infectious in the community for up to 10 days. They've linked that case now to the marine pilot who tested positive to COVID last week. Initially, they thought that marine pilot was infectious from around July 29th. They've now backdated that in light of the fact that this taxi driver, they believe, contracted the virus from that marine pilot on the 26th. So they've now backdated the contact tracing for that marine pilot back now to July 23rd. Overnight, a list of new exposure sites was listed in the far north. They include several major shopping centres and supermarkets on Cairns north side, in Cairns west, and also in the Cairns CBD. There's also a Bunnings site. It seems to be a pattern that we're seeing there across the country. There's also Rusty's Markets, which, Joe, as a far north Queenslander, you might be familiar with, a very, very popular fruit and vegetable market that runs across the weekends, that is generally attended by thousands of people across the weekend.
Used to be called Rusty's Bazaar back in my day, I think. And Mark, is there any early indication of lockdown being lifted? So the lockdown, this initial lockdown period ends at 4 p.m. today, is it?
That's what we're being told by Queensland Health. The short answer about whether we know whether it's going to end or not is we don't as yet. The Premier and the Chief Health Officer have just released that they will stand up at 10 o'clock today to give us the latest update. We are, as I say, unsure whether this lockdown is going to end, and it may hinge on the fact that we are still waiting on thousands of test results from a lot of those private clinics.
Yeah, OK, Mark Rigby reporting there from beautiful Cairns in far north Queensland.